Good evening. Welcome to the Ask Me Anything with Dr. Twyman. I'm a board certified cardiologist, and I've been doing these Ask Me Anythings every Monday, 6 p.m. Central Time since 2020. So I help you become heart attack proof. I do that through answering your questions about vascular health, lipoproteins, mitochondrial health, circadian biology. Tonight I can try something a little bit different. So every Monday morning in my Instagram stories, I post a Q&A box. That's where the questions can be submitted ahead of time. I answer them in the order that they're received. And if we have time, and usually we do, if you have questions, drop them in the comments if you're joining live. The archive of this will live in my Instagram feed for at least a month, but I usually try to take the video from this, put it onto my YouTube channel, which is just drtwyman.tv. Tonight, using a different service that's going to help me stream live to YouTube, LinkedIn, might go to my Facebook. There's a big glitch on that one. So we're going to see if this works where I can try to get more people watching this live. So if you're not following me on other platforms, this is where I've been doing it for the past 6 years, but I'm going to try to do a little bit more on YouTube. That's where some of my longer form content will live. But if you're looking for all my long form content, most of it hits my school community first. That's my tribe of people where we're trying to become heart attack proof together, learning along the way, using some different AI tools to kind of summarize some of the different podcasts, YouTube videos, and conferences that I listen to and attend respectively. So with that kind of housekeeping out of the way, we'll jump into the questions tonight. So the first question tonight is, how do you find out if you have soft plaque? Great question. Not all plaque is considered equal. The hard plaque is typically more stable. So soft plaque typically can be assessed with either a carotid ultrasound or a CT coronary angiogram. CT coronary calcium scores really only see the hard calcified plaque. If you have a calcium score of 0, you still may have soft plaque in at least 8% of the time. If you have a positive calcium score test, which is defined as any score over 1, you have soft plaque probably, but just how much is really the question. So CIMTs and CT coronary angiograms are the main way people figure out if they have soft plaque. Question about hormone replacement therapy, HRT for women, if they have a positive CAC score and levels are low. So it does depend also on your risk for breast cancer, your history or lack of history of deep vein thrombosis or pulmonary embolism. Hormone replacement therapy can be used, effectively for many women, but you have to know a little bit more just to say that it's going to not cause a non-cardiac problem. Very low risk otherwise. Estrogen is a vasodilator. Progesterone may help you sleep, and if you're low in testosterone, you may benefit for libido purposes, but also to maintain your muscle mass. Where is the best place to start on my content if you're new and want to see the big picture first? Great question. Welcome. Thank you for following. My YouTube channel has a video called No Time to Die. That is a video that I put together where it goes through the different vascular testing, as well as my philosophy on how to look at vascular health from a non-lipid centric approach. Lipids matter, but you have to think about how healthy the vascular endothelium is and how much oxidative stress and inflammation you have. So the No Time to Die video on my YouTube channel is probably a good start point. I've been on over 80 podcasts. If you just put my name into a podcast search box, you can find some stuff. But some of my more in-depth podcasts are with my colleague and friend, Dr. Gabrielle Lyon. Been on her show twice. Drew Purehead's show. Have 2 different podcasts with him. One of them is where we went through the Clearly analysis and his genetic testing. So if you're looking at more like how to read your own labs, the one I did with Drew Purehead's also a good one. And for more of a biohacker, I was on Dave Asprey's Human Upgrade podcast about a year ago. So I was talking about circadian biology and blue blocking lenses. Question, how to help stop receding gums. If you have periodontal disease, that can be a risk factor for vascular disease. There's an enzyme called LP-PH activity that's often elevated if people have periodontal disease. So how to stop? I'd recommend working with a biological dentist. May need some type of kind of testing where they can look at the oral microbiome to see do you need to be treated, and that's where I would start with. Next question tonight, 77 year-old female. The mother died of a heart attack at age 77. The patient is on a statin with a calcium score of 600. So a calcium score of 400 is considered high risk. It's the equivalent that you've already had a heart attack or have stents or have had bypass surgery. The stress test being good is a marker that you unlikely have a severe stenosis of one of your three major coronary arteries, but does not tell you your risk of a heart attack or stroke with the stress test. The other data point you get from the stress test is your exercise capacity. How many minutes did you go on the stress test? What was your heart rate recovery? How quickly did the heart rate drop when you stopped exercising? Ideally, heart rate dropped at least 12 beats in that first minute. What are the more tests to consider? Well, do you have things that are affecting your nitric oxide pathways like high uric acid or high homocysteine or high ADMA? Do you have high inflammation such as hsCRP, LP activity, myeloperoxidase, OXPL, ApoB, OXLDL? So if you have a lot of inflammation or oxidative stress, the arteries are on fire, more likely you're going to continue to lay down plaque. And then from the lipoprotein standpoint, we'd like to look at the particles more than just the cholesterol. So you can look at the LDL particles and you can look at ApoB. Question about a calcium score of 140, panic? No, not necessarily. A calcium score that's above 0 does warrant further investigation of what's causing it, get to the root cause. But if you live long enough, almost everybody develops plaque. So it depends on at what age is a score of 140. If you're 70, 80 years old, that's probably pretty normal for age. If you're under 40, that's a high risk finding. So it's more about your age than anything where the score is. Your score should be 0 for as long as possible. I have seen patients in their 80s with scores of 0. I've seen patients under 40 with scores of nearly 1,400. So the cut points again, 400 is high risk, 1,000 is very high risk. Scores over 1,000, you may have a 1 in 3 chance of having a heart attack in the next couple of years if you don't do something about it. So it's not panic, but you got to figure out what's causing damage to the endothelial glycocalyx, aligning the arteries, how much inflammation do you have, and look at your lipoproteins. Start there, but it's always, there's more than that, just, kind of Instagram sound bites. It's got to work on your circadian biology, stress management, sleep. It's all connected. All right, question. Top supplement for heart health and lipids. There wouldn't be one that would hit all, but I would always focus on something that would support nitric oxide. And supplements are just that. They're supplemental to what everything else you're doing. So I often talk about 4 pillars of health. There's your exercise, there's your nutrition, there's your stress management, your sleep. If you're not sleeping well, start there. If you sleep well, you age well. You need to sleep well so that your mitochondria work efficiently in making energy for you when you're pushing the foodstuffs in them the next day. And when you want your, engines, I call the mitochondria, you want them to go fast for you when you're exercising, you have to sleep well for that process to happen. So from a vascular standpoint, though, you need nitric oxide to dilate your 60,000 miles of blood vessels. In vascular health, a lot of issues sometimes will start with endothelial dysfunction. So that would be that from a supplement standpoint. Lipid supplements, that's individualized. You need to know what else is going on with the person. So there's not one that works for all. Question, is there anything that is useful to do or take for aortic regurgitation? It depends on what's causing the aortic regurgitation. Do you have a bicuspid aortic valve? Have you had endocarditis? Do you have history of dilated aortic roots, like an aneurysm? So what's causing the aortic regurgitation is where you would understand that if you need to do something different. You generally want to keep your blood pressure controlled. So I always still mostly shoot for people blood pressure to be 120/80. But when you have aortic regurgitation, you often will have a wider pulse pressure. So the pulse pressure is the difference between your top number and your bottom number. For example, if your blood pressure is 120/80, your pulse pressure is 40. But if your top number is 120 and your bottom number is 40, your pulse pressure is 80. The wider the pulse pressure, the more likely the aortic regurgitation is more on the severe side. So there's nothing, for the most part, that's going to make it better. You're just trying to slow down the rate of degradation or degrade of the valve. So aortic regurgitation is often a mechanical problem that if it becomes symptomatic, you'll need a mechanical fix for, requiring surgery. And then last pre-submitted question tonight. What are the most important tests to get an initial overview on heart health? Great question. This is one we answer for our patients that come to see us at Apollo Cardiology. And it's a head-to-toe assessment. You have nearly 60,000 miles of blood vessels, so do the detective work and figure out where the person may or may not have plaque. So start with carotid arteries. And look, does the person have soft plaque in the carotid arteries? Do they have a thickened intima? The intima is the layer of the artery underneath where the blood is flowing. That intima is basically thickened and swollen. You may have evidence of cholesterol particles being retained in the artery. You have inflammation in the artery. If you have not had prior cardiac testing looking at the heart directly, we'd recommend generally a CT coronary calcium score or CT angiogram, possibly with AI analysis. We would look at ankle brachial indexes to look for peripheral arterial disease or blockages in your leg arteries. We would look at central aortic blood pressure, the blood pressure as it comes out of your heart, the blood pressure that the aorta faces. We would look at reactive hyperemia, which is essentially how much your arteries can dilate when they're under stress. So this is a test for endothelial dysfunction. We also look at pulse wave velocity, which is a marker of how stiff the arteries are. So we're doing multiple tests looking at the earliest stages of vascular dysfunction. So that is the starting point. Look at the biophysics. It's more important than the biochemical. Biochemical just can infer like what you need to do differently, lifestyle-wise or medication-wise, supplement when necessary. All right, so those are the pre-submitted questions. We'll check and see if anything pops up in the comments. So for those that are joining, was always going to be, in my archives on my Instagram feed, but trying out something new tonight. Going to be streaming this as well on my LinkedIn profile, my YouTube video, and I believe it's going to stream into Facebook, which Facebook doesn't always work so well for me, so I'm not expecting that one to work well. So this is kind of a demo for that. But my long form videos, some of them still live on YouTube. So if you're looking for the No Time to Die video, that's there. How to read your own labs. So I go through an example of how to read my own personal labs, how a cardiologist interprets his own labs is one of the videos. That video is up there, how to interpret results from a CT coronary angiogram. So there's an AI analysis testing that you can look at. It tells you how much soft plaque or hard plaque you have in your arteries. So if you're really interested in those long form videos, that's living on my YouTube channel, which is drtwyman.tv. If you're wanting even more content and you want to be able to do call in live videos with me, I do some Ask Me Anything things in my school community, as well as put some AI-generated summaries of the podcasts that I listen to, videos that I watch, and then more importantly, the conferences that I attend. I'll be attending the American College of Cardiology conference soon, learning about the newest clinical trials. So expected that the LPA trials are going to be announced at this conference. So trying to sit in the audience and be one of the first people to hear if the phase 3 trials are positive and if these drugs are going to be coming to the market anytime soon. There's also going to be many topics on AI and cardiovascular care, so that's something I'm keeping my eye on and been using as much as I can in my practice. So if you're interested in learning along with us, the school community is where it's at. The link is in my bio on the Instagram feed, but if you just go to drtwyman.com/school, you'll be able to find the link as well. There's a 7-day free trial, so no obligation to stay, but it seems like it's something that can help you become heart attack proof. Hang out with us and learn along, and we're gonna keep doing things together. And as I learn more, I'll keep teaching more. Then the last bit of business is that I still see patients one-on-one in my practice at Apollo Cardiology. Right now, my wait list is about 3 months. If you're interested, my website has the application. My team would reach out to you, and they would make sure that we're a good fit. But if you're interested in this vascular assessment, looking at 60,000 miles of blood vessels, looking at genetics, looking at your lifestyle, looking at your medicines, your supplements, and making sure you got an optimized plan for you how to be healthy, give us a call or apply online. I'll be happy to work with you. So every Monday, 6 p.m. Central Time, we'll be back. It's usually going to always be questions submitted through Instagram, but if I can figure out how to stream this on other services, I'll try to let people try to figure out how to answer more questions there as well. So hope you guys have a great rest of the day, and I'll see you next Monday, 6 p.m. Central Time.